Good morning, everyone. Today I will be discussing on drug utilization evaluation. What is the importance of doing DEV or drug utilization evaluation studies? So basically, upon the completion of this particular content, we will be understanding what is the definition of drug use evaluation or drug utilization evaluation. What is the need of doing DAV? What are the aims and objectives of drug utilization evaluation studies? How do we classify the DUVs? And what DUV committees consist of? And what do you mean by DUV cycle? What are the different phases and steps involved in conducting a DUV study? And what are the resources as well as tools which are required for conducting a DUV study? And what is the role of pharmacist in drug utilization evaluation studies? And what are the conditions or when the DUVs go wrong, and what are the problems usually we face during conducting DUV. So coming to important definition of drug utilization evaluation is we define it as an ongoing authorized systemic quality improvement process, so which is designed for the purpose of reviewing a drug use and its prescribing patterns and providing a feedback of results to the clinicians and other relevant groups or healthcare professionals. By developing a criteria and standards, we are doing this study to describe optimal drug use process in the hospital and promote appropriate drug use through the education and other interventions. So it is an ongoing process and it is authorized, and this process is going to improve the quality of drug use process. That's what every hospital should do, drug utilization evaluation study, to increase the optimal drug use. So it is also called as drug utilization review or medication utilization evaluation, also said as MUE, or we also can call as medication use evaluation. These are other synonyms of drug utilization evaluation. So why we need to do DEV? The next question is, if we want to do a DEV, what is the necessary of doing it? Why we need to do DEV is irrational medicine as well as inappropriate drug use are very high. Because of irrational medicine use, inappropriate drug usage, there is an increased cost of medical care, and there is a chances of antimicrobial resistance as well as increased adverse effects, and the patient mortality is very high. To avoid these all, we need to do drug utilization evaluation study. The second point is there are increased number of medicines which are available with us, as well as there are increased treatment options. So because of these two, there is an increased number of irrational medicine treatment which leads to the poor patient outcome. So to avoid this, we need to do DEV. And third point is polypharmacy is one of the big problem, because providers may use 3, 4, 5, sometimes more medicines to treat a particular condition for the sake of satisfying patient needs to receive medicine. For example, sometimes it is even more related to pharmaceutical sellers. Because of their own profits, they sometimes make others to prescribe, make physicians to prescribe some other more brands. So because of polypharmacy, more ADRs. So because of more ADRs, increased cost, hospital cost to the patient. So we need to do DEV. Other reasons for polypharmacy may include sometimes lack of diagnostic competencies in the physicians or confidence, and inadequate knowledge of treatment regimens may lead to polypharmacy and may lead to ADRs, so or antimicrobial resistance or increased treatment costs. So to avoid this all, we need to do drug utilization evaluation study. And as I discussed, a higher number of ADRs lead to treatment failure, because treatment failure may occur because of incorrect medicine or prescribing incorrect dose or prescribing medicine that is most significant to cause ADR or drug interactions. excessive number of non-formulary medications used. When there is no hospital formulary in the hospital, then non-formulary medicines are quite common to use it. When you use it, there is a chance of developing ADR. Then excessive number of medicines within the therapeutic category, because if you take a one single class of drug, there are so many other categories are available. For example, if you take a diabetes mellitus, where we come across oral hypoglycemic agents, we come across biguanides, we come across sulfonylureas, we come across alpha carbose inhibitors, even we have insulins also. So when we have a different category of particular class is available, physician may have a chance to use his own choice of drug by his own practice. So because of more excessive number of therapeutic category, there is a chance of increased ADR lead to treatment cost, high treatment cost to the patient. So that's why DUV is a systemic improvement system of improving the quality of a medicine used in hospitals and clinics, and is an ongoing systemic criteria based program of medicine evaluation that will ensure appropriate medicine use. So that is a reason we need to do drug utilization evaluation study. So this DEV study is structured so that it will assess the actual process of administering or dispensing a medicine, that is by checking appropriate indication, appropriate dose, as well as drug interactions or medicine interactions, or assessing the outcome in the patient, that is whether the particular infection is there, whether that particular infection is cured or not, decreased lipid levels. For example, if patient going to the clinic with obesity, what are his lipid levels, and after providing particular hyperlipidemic agents, whether these lipid levels are decreased or not. For example, if patient is coming to the clinic with because of increased blood sugar level, and if anti-diabetic medications are prescribed, whether that particular drug, for example, if metformin 500 mg is prescribed, whether that relieved the or that is decreased the sugar concentration in blood or not, that has to be checked. So where we can easily to identify is by providing or by doing a DEV study. So if you want to do a DEV study, one must have aims and objective of doing a DEV. The main aims of doing a DEV study is to promote a rational drug use, so that patient quality of life should be improved. So the promotion of rational drug use can be done by reducing drug as well as health related treatment cost to the patient, improving patients health related quality of life, that is HRQOL, improving patients quality of medical treatment, improving coordinated healthcare, where pharmacy, if clinical pharmacist is there in the hospital, he can collaborate with the physicians and nursing staff, and he must collaborate in identifying ADRs, identifying drug-drug interactions, identifying medication errors, so that improving a coordination between the healthcare leads to promote a rational drug use. So decreasing the number of medicine related problems, or you can call it as an drug related problems, and identifying the medication errors in the hospital, decreasing the number of hospital admissions, and improving the prescriber awareness as well as practice towards the appropriate prescribing leads to an increased rational drug use, leads to an increased HRQOL in the patient, that is health related quality of life. So one must have some objectives of doing DEV. The main objective of doing a drug utilization evaluation study is ensuring that every pharmaceutical therapy or drug therapy should meet current standards of care, and or else criteria or guidelines which is particularly available for the diagnosing particular disease. For example, if you take hypertension, we have a JNC 8 criteria to treat a hypertension, whether the particular criteria is followed or not, that has to be checked. Promoting optimal medication therapy, one must promote needed actual drug content to treat a particular condition, and preventing medication or drug related problems. There might be ADR, there might be a drug interaction, or supratherapeutic dose, subtherapeutic dose, anything related to drug related problems should be stopped, it should be prevented. Identifying specific medication use process or medicine use process problems that requires further evaluation, and creating criteria or guidelines for appropriate medicine use or drug use, defining thresholds for quality of medicine use, how much threshold that particular drug is available and what quality it should reach to the patient, enhancing the accountability in the medicine use process. One should enhance accountability of the medicine use process and controlling the pharmaceutical cost. So these are the some objectives which are put for conducting a drug utilization evaluation. The next is we classify adverse drug reaction. We classify drug in DUV, that is drug utilization review or drug utilization evaluation, in three different categories. One is prospective DUV, another one is concurrent DUV, third one is retrospective DUV. Prospective DUV is, or DUR is a one where evaluating a patient's planned drug therapy before the particular medication is described or prescribed. So here this particular DEV helps to the pharmacist to assess prescription medication dosage, drug interactions, and resolve the drug-related problems. Some of the common issues which can be addressed during a prospective DUR are clinically abused or clinically misused drugs. Pharmacists can identify drug interactions, drug dosage modifications, or drug disease contraindications. For example, any particular drug is contraindicated in particular condition, that has to be checked. For example, if the patient is having hypoglycemia, what are the contraindications for hypoglycemia, that has to be checked. For example, if patient is type 2 diabetes mellitus and patient is prescribed with beta blockers, so usually beta blockers mask the sign and symptoms of hyperglycemia as well as hypoglycemia, that has to be checked here. So drug disease contraindication has to be always identified by doing this prospective DUR. Even drug patient precautions also can be identified. For example, particularly in terms of allergies, in terms of gender, in terms of pregnancy, in terms of age, any particular precautions has to be taken, that has to be seen. For example, if in terms of age, if patient is a pediatric age and dosage adjustment has to be done, that has to be done here. And if the patient is having already known allergies, if that particular drug is prescribed, that has to be easily identified. As we know that in case of gender, females are more prone to develop ADR than the male, that has to be again checked it out. If any particular drug is used in the pregnancy which is contraindicated, that has to be checked. So drug patient precautions can be easily identified during a prospective DUR. And coming to next is formulary substitution. For example, if particular drug is not added in the formulary or hospital formulary, that has to be done. Example, therapeutic interchange, any particular class has to be interchanged, that has to be done here. Generic substitution, any particular generic substitution is not there in the formulary list of the particular hospital, that has to be added. And inappropriate duration of drug treatment is available, that has to be minimized by doing prospective DUR. One example here I mentioned is identification of drug-drug interaction are very common outcome of prospective DUR. You can take many of drug-drug interaction example. Even you can identify drug-food interactions also. So if we all know that aspirin plus clopidogrel, when we use commonly, there is a chance of increased bleeding. So this is how when we do a prospective DUR, we'll come to know that what is the outcome of drug-drug interaction that can be easily minimized in case of a prospective DUR. A second one will be the concurrent DUR. Here it is performed during the course of the treatment, and it is ongoing monitoring of drug therapy for the patients for positive outcomes. It represents where a pharmacist with other opportunity to all the physicians to alert prescribers for potential problems, as well as even in case of drug interactions, in case of duplicate therapy, even over or underutilization of drug, excessive or insufficient dosing. So concurrent DUR, the DUR where it is going to help clinical pharmacist to develop a good rapport between the physician and other healthcare team and during concurrent DUR, because here we are identifying directly in terms of treatment course, and we are monitoring the DRPs which is going to have a positive outcome.